We don't actually know how many people have or have had COVID-19 in the US right now. We know how many positive test results there have been, but that's really different from the number of cases. For starters, not everyone has access to testing. There have been different policies in different states and cities since the pandemic started about who is even able to get a test. There's a delay in getting those tests back. There are pressures on people to get tested or not to get tested for all sorts of reasons. There's a lot of policies in place. If you can't afford to take leave from your job and you don't have paid leave, you might just not get tested even if you know that you've been exposed. So all of those are questions that we really need to be thinking about too as we're looking at those numbers. How is that number generated? What is that number actually? What's not going into that number? What don't we know?
Is the incidence of coronavirus more or less than influenza? Are the elderly more or less susceptible? Is the incidence of coronavirus more or less now than in March? In New York City than in New Orleans? The important thing to remember is that everything is an estimate.
My graduate degree is in linguistic anthropology.
My training was as a cognitive and social psychologist.
I think ethnographically, which means I'm always paying attention to lived experience, context, and especially power.
I did at one time have a flirtation with neuroscience.
I try to read widely in communication and journalism studies and everything in between.
My methods are generally those that would be recognizable to data scientists and other computer scientists. But I care mostly about the very human level. Knology tries to create an environment of transdisciplinarity. It is a discussion we have at Knology all the time.
I'm really influenced by the work of two scholars here, Julie Thompson-Klein and Lynn English. Multidisciplinary approaches, as Klein puts it, disciplines speak as separate voices to common themes. So it's different ways of approaching the same problem. Whereas interdisciplinary approaches really blend disciplines and link concepts. So you're starting to really talk together. But it's not until you get up to the transdisciplinary approaches that you have to totally restructure disciplines and start from real world problems. It's fundamentally synthetic. You just don't have the purism that you have in disciplinary approaches.
In the doing is where you actually see it most at Knology.
In practice, this sometimes means we argue a lot in our office.
We have a team that comes from different backgrounds, different expertise, different skill sets, different viewpoints. What are the immediate questions they would ask of something? And over time, you actually do start to see it from the other people's perspective. COVID-19 is not just about behaviors, it's about intentional behaviors. It's about the decisions you make and the why you make them and who nudged you in that particular direction and how are you nudging others in other directions and how does it get sustained through the shared meaning you're making with others.
I researched the relationship between COVID-19, the use of numbers in public discourse, and what's called numeracy or statistical literacy or quantitative reasoning.
It's about having the language, yes, to do some individual reasoning, quantitative reasoning, but it's more about the quantitative reasoning that we do in groups. Because the number system of mind that just happens biologically and with some life experience and training looks different, is adequate to individual quantitative reasoning, but cannot be shared. You can't stick your thoughts in somebody else's head except through the very narrow channel of number words.
I'm paraphrasing researcher Ido Gal here. The ability to interpret and evaluate statistics and data, not just to make sense of those numbers, but to place them in their appropriate social context.
A certain people in the Amazon do not have recursion ever in their spoken language, and they don't have written language at all. People were numerate, or they could do quantitative reasoning, but that quantitative reasoning looked nothing like a number line, looked nothing like what we would call numeracy. And it all the more emphasized the fact that numeracy is not about numbers, it's about language.
I am the co-PI of a 4-year National Science Foundation grant with PBS NewsHour, looking at how statistical information is presented in the news media. We started the grant last summer, July 2019, and by February, when we were collecting a landscape set of news articles, COVID-19 was everywhere. It felt like every quantitative story was about COVID-19. How many cases, where and when, infection fatality rate, case fatality rate, R naught, RT, you name it. Numbers upon numbers, graphs upon graphs. So while I didn't come into this project planning to look at COVID-19, it's occupied quite a lot of my time.
The COVID-19 epidemic is a situation where now is important, and figuring out how it works is very important. How news consumption patterns and habits are affecting people's behaviors. Whether they actually perform the behaviors to keep themselves and others safe, whether they understand them as something that keeps themselves and others safe, whether they care.
The kinds of questions I'm asking are, what are the discourses around COVID? How do certain kinds of discourses and certain institutional positions gain authority? How do these discourses circulate? And when I say these discourses here, I'm largely but not entirely talking about statistical information.
Does the way numbers are presented have an effect on behavior, whether it's visual or in a table? Does that change things? If we acknowledge that it's provisional because we've never seen this before, does that change things?
I'm also really informed by frameworks from medical anthropology. Charles Briggs talks about something he calls communicability, which links different notions of communication from linguistic and medical anthropology. And there are a lot of people, and I want to really call out specifically Adia Benton and Durga Sangaramurthy, who are working on the circulation of numbers and data in health contexts. What are people doing with data, and why does it matter who's not getting counted?
There's no such thing as just plain data collection. There's no such thing as a question that can only be answered in one way.
I come back to STS, that's Science and Technology Studies, especially the more critical and feminist areas of the field. What they bring to the table is that they remind us that numbers are a technology. Who gets left out? Who gets privileged? Who gets erased when we talk about numbers?
What even are inferential statistics? What is a number? What is an estimate? What does it mean for a number to be official? We're seeing evidence of some fundamental misunderstandings in our studies.
All of this is further complemented ethnographically by my own personal experiences with COVID as a citizen. I'm trying to make sense of these numbers. I'm following my governor. I'm following the New York governor. I'm trying to figure out what numbers do I need to use to inform my daily decisions. And so I'm bringing that to the table with me too, thinking about where do I get stuck as a citizen, and particularly as a citizen who is numerate, who is statistically literate, who does have the capacity to think critically about all of these numbers. Where might someone else be getting hung up? So those are questions that are constantly at my mind when I'm looking at specifically the public statistical communication around the pandemic. And then, of course, I also have colleagues in journalism asking, what do we need to know to do our jobs well?
From the tests we've been able to run, I have not been actually seeing any kind of deep understanding of what the quantities mean. I have not been seeing any very strong evidence that people are using them to reason. People use the numbers that are associated with COVID-19 to sort of give themselves psychological comfort. The numbers give the journalists comfort in talking about COVID-19. They make the people who are consuming the news feel like they know and understand and could have control something. The whole notion is that somebody knows. If a number can be generated, somebody knows something. And therefore, because I'm part of that same community, that same world, I know it too.
I want to study boredom as a motivator. A long time ago, I applied to art school, and I had to answer why I made art. I said to dispel boredom, to make a moment of purposeful strife. Many decisions that I have seen people make during the plague seem to be motivated by a desire to dispel the boredom of quarantine.
I'm not just interested in the news media. I'm also really interested in other questions of positionality. How do political actors like governors and mayor communicate about data and statistics? And how does that compare to the news media? My governor, the governor of New Jersey, is really obsessed with COVID statistics. He's been communicating every day, and now it's every other day, a whole massive data dump of statistics about the pandemic. But what is he doing with them? I would argue that he's mostly using those numbers to justify his political projects. So while numbers are always contested, what ends up happening is that political actors are using them to make things feel like questions of expertise, technical questions, rather than political questions that can be contested.
This image comes from New Jersey Governor Phil Murphy's Twitter account. I conducted a recent workshop on critical statistics for a group of people with a wide range of statistical background knowledge, and I asked them how these numbers were calculated and what this image showed. One person said, "I have no idea what this is about, but whatever it is, it was bad in April and it's good now." I think that's a really telling way of looking at it. We tend to assume that public figures, like the governor, are providing these kinds of numbers to inform us. But my friend's comment shows that the public doesn't necessarily understand the specifics of these numbers. Instead, they're interpreting them more generally. From an official perspective, how well is New Jersey handling the pandemic?
There are other less official ways of counting, embodied ways of counting. How many ambulance sirens do you hear in an hour? How quickly do people cross the street to get away from each other? How long can you hold your breath at the grocery store? How many Zoom funerals have you attended?
We sometimes get so bogged down into numbers and the analysis we're going to perform on those numbers and whether they meet all sorts of mathematical rules and assumptions that we sometimes forget that they are proxies for a thing that we are actually studying.
The one thing that I absolutely want people to take away from the work that I do is this. Numbers are not objective, ever.
What is the thing that you are studying? And remember that the quantities are only a convenient representation.
Behind every number is a series of human choices.
People get stuck on the survey response. How much do you agree? And lots of times it's those little categorical responses. And it's like, what you're studying is not whether it's a 4 or 5. You're studying agreement.
And so I want you to be able to think about the questions you can ask yourself to make those choices a little bit more visible.
And because you can't literally measure an attitude with a tape measure, you could only get somebody's numeric estimate. If this thing were on a number line, how far away is it from 0? How far away is it from the top?